Hi, I'm Matt. I'm a prescriber in the ADHD medication clinic. I understand your child may have recently been diagnosed with ADHD, and in this webinar I will discuss medication, how it might help and what to expect, as well as some other strategies. So this slide describes what we do in the ADHD medication clinic. Not everyone with ADHD will need medication, and it's really important to try and make adaptations first, if possible, before trialing medication. Adaptations at school are particularly important, such as movement breaks, sitting near the front of class, using simple instructions, encouraging your young person to regularly engage in exercise, which is massive. It's recommended for young people with ADHD to have about an hour of exercise a day. This will help not only with their ADHD symptoms, but also with things like sleep and mood and mental health, etc. It's also quite good when you're speaking to a young person to give limited options. I'm going to talk a little bit about the medications that we use, mainly about methylphenidate, just because this is the first line medication, and I'll also give you some resources at the end where you can read up a little bit more about medication. It's important to say that we are an ADHD medication clinic and not a sleep clinic. Unfortunately, although we do prescribe melatonin, it's not a first line, and it's only to people already established on ADHD medication. So if you do come to our clinic, it's important to realise that we might not be able to prescribe melatonin, unfortunately, initially, but there are things like the sleep clinic, which is more their expertise than ours. Now I'm going to talk about sleep hygiene, which unfortunately is a common difficulty for young people with ADHD and autism. Here is outlined some things to really kind of focus on to hopefully try and improve your young person's sleep. Really want to stress the importance of avoiding artificial light such as phones, tablets, iPads, laptops, PlayStation, Xbox. Really important to have boundaries around sleep, so having a consistent bedtime. But also kind of coming off of devices at least kind of an hour or even 2 hours before bedtime to help kind of improve sleep, in terms of making it easier to get to sleep, but also sleep quality when you are asleep. Important not to eat too close to bedtime as well is really important. In terms of circadian rhythms, avoiding artificial lights is important because it effectively tells your body and brain that it's not, if you see an artificial light, it tells your body and brain that it's time to stay awake and not to go to sleep. The same with eating as well. So you want it to kind of your mind to associate bedtime, and all of these kind of feed into having kind of good circadian rhythms and then getting a good night's sleep. So some things that can be really helpful for getting a good night's sleep. I think reading, personally, I find that reading a book before bedtime can be really, really helpful. Just like kind of 10-20 minutes can really help you kind of switch off at the end of the day and get to sleep. Having a bedtime routine and trying to be quite consistent with that. So maybe, you want to kind of have maybe at least an hour of winding down a little bit. So maybe like have a bath or do a bit of reading, do a bit of washing up. Although that might be ambitious for some young people to ask them to do that. But try and like kind of do winding down activities. If they're not into reading, trying to find like maybe podcasts might be more appropriate, or audiobooks, or having the radio on. Just there's always going to be an element of trial and error. So it is about finding what works for your young person, but trying to be kind of consistent. Once you've got a good routine, to kind of stick with that consistently. So my son has autism and ADHD, and I find it really helpful. He's had quite a lot of sleep difficulties, but what's worked really well for us is incorporating exercise and making sure that he's busy every day. So when he gets back from school, making sure that we go for a walk, go to the park, play in the garden, down the trampoline, or do some kind of club, if they're able to do that. Find it really, really helpful, and makes it a big difference in terms of getting to sleep, but also staying asleep. So even though you might be going outside in the cold, wet and dark, I think it's normally, most parents would agree that it's worth it if you get a good night's sleep. So definitely exercise is massive for sleep, but obviously not too close to sleep time, because then that can unfortunately make it more tricky to get to sleep. So yeah, some of these might seem obvious, but it's important to kind of state them, especially to young people, because they might not be aware of them. Quite commonly see young people who are drinking Red Bulls throughout the day and then not getting to sleep. So try not to have any caffeinated drinks after midday. Obviously avoid alcohol because that makes it more difficult to get to sleep, but also makes sleep quality not as good. Things like smoking and vaping as well. Obviously vaping is very common currently, so that can have a negative impact on sleep. Try and avoid the temptation of buying kind of over-the-counter sleep medication. Try and speak to a medical professional first. Magnesium does have an evidence base for helping get to sleep, which it's best to take 1 to 2 hours before going to sleep, but please do speak to either your local pharmacist or GP before starting that to make sure that it's safe to do so, and trying not to eat too close to bedtime. And just also like kind of really praising your young person when they do sleep well. So maybe this might be for younger children, but having maybe like a reward chart, things like that when they sleep well, and maybe just, it doesn't have to be kind of anything that costs money, but letting them choose what's for dinner, letting them have half an hour extra on iPad, things like that can be really quite effective to kind of get them invested in improving their sleep. So I have briefly mentioned the different types of ADHD medications. Methylphenidate is the most commonly used, it's the first line, it's the most researched, which is why we use it as a first line. It tends to be pretty effective as well. 70 to 80% of young people with ADHD who take it tend to get a benefit from it in terms of improvement in symptoms. It's important to know that, it will treat some aspects of ADHD, but probably not all of them, which I'll give you some resources to read a little bit more, but mainly it helps with the inattention side, so your concentration, focus, maybe might reduce restlessness a little bit, and might slow down thoughts, which in turn might kind of hopefully help with impulsivity. It might only help with a few of those aspects. Some people it helps with all, which is great, but I'd expect young people with ADHD to get at least some benefit from it. And with all medications, it's kind of looking at outweighing the pros and cons, because unfortunately all medications do have side effects, but it's impossible to know what they're going to be until you try the medication. So there is an element of trial and error with medication to find the right one for your young person. But it's not the only option, and there are other options, so it's not the end of the world if your young person doesn't get on with it. So talking still about ADHD medication, it's important to realise that it's not a magic cure, unfortunately, of some symptoms, and things like it won't help, or unlikely to help with things like anger or behaviour. It only helps with the inattention, things that I previously mentioned in the previous slide. So just to be aware of that, and it tends to help mainly at school, especially the stimulants. So it might not help behaviour in the evening at home, unfortunately. So it is important to kind of learn as much about ADHD as possible, because the better you understand something, the better you will deal with it, and have strategies around that, but also kind of use the resources and the AES workshop and things like that should really help, hopefully, with that. The only other thing, obviously, you can read the slide here in terms of cardiac problems. Unfortunately, there's quite a long wait for medication initiations. So what we don't want is for you to wait and then see you at the initiation and find out there's some cardiac problems which make it not possible for us to start the ADHD meds. So if you see some of the things listed here and think, oh yeah, my young person has that, or of a family genetic condition or some heart problems in the family, then I'd really kind of recommend trying to get an ECG done, or trying to get a GP referral to cardiology before the appointment, just so your treatment's not delayed. So while you're waiting, you can kind of actively, hopefully, improve the time that it takes to get started. Unfortunately, currently our waiting time is a lot longer than we'd want it to be, and obviously we're working hard creatively and as adaptively as we can to try and get that down. We're looking to employ new staff and things like that to hopefully get it down. Currently it's 15 months, which is the longest it's been, certainly since I've worked in the team. So yeah, it's just to give you the heads up, really, that if you are thinking about it, then to make that referral to us. But yeah, we are looking to get it down, but I think it's really important to kind of use some of the strategies and adaptations that we've talked about, to try and hopefully help your young person in the interim, and try and really reading up as much about ADHD as possible, like learning as much as you possibly can. In the next slide, I've got some resources which I'd kind of really recommend. So these are some of the resources. I didn't want to give too many, but just some of the ones that I found really helpful personally. So the Cereba website has some really good stuff on sleep. They have like the gold standards for sleep, which there was a really good research article on, which improved sleep for I think 60 to 80% of young people in that study who had autism and ADHD. So that was a really good study. But so really, they've got like a little leaflet that you can print off and use from there, which is really good. And that really helpful. The ADHD Foundation is really good. It's got lots of good articles on there, and lots you can get a lot of information without spending a huge amount of time on there, which is always a good because we're all pressed for time. And then the NHS Sleep Hygiene, Fall Asleep Faster and Sleep Better, which is on the nhs.uk. Just Google NHS Sleep Hygiene and it will come up. It's a really good kind of article. Found it really helpful personally, and I regularly often reference it. And then if you wanted a bit more information about the ADHD meds, thinkadhd.co.uk, which is never actually a good website, but /treatments and medication. If you go on there, they'll be able to talk you through more information about ADHD, but also a little bit more about the medications. But yeah, obviously look forward to maybe meeting you in the future, but wish you all the best for your journey.